work are called modalities. Tui Na is massage from China. Qi. Qi is the life force that exists within us. And if you've done Qigong or breathing exercises, you may have been exposed to the concept of Qi. Ayurveda is a specific type of medicine. It's a holistic approach to balance body, mind, and spirit, many times from India. Here's a few fellows you'll hear about later in the lecture, but this is a quick cheat sheet. Hippocrates, the father of medicine. Asclepiades, a Greek physician living in Rome, made massage exercise and hydrotherapy very popular. Per Heinrich Ling, a biggie, father of massage, founder of Swedish gymnastics. Also Dr. Johann Mesger. He's from Holland, but he was the first to identify classic massage strokes. Dr. Charles and Dr. George Taylor, those are two brothers who brought massage to the U.S. And Dr. Kellogg, an American physician who did the first intensive research on massage therapy. So just a little highlight before we get started. And away we go. So the historical roots of massage intertwine very naturally with the history of ancient medicine. So in most civilizations, in most ancient civilizations, medicine was a ritual. It was magical. It was believed that people got sick because there was a demon possession, there were evil spirits, or they had sinned. So medicine was part of religion. So shamans and priests used massage and other practices to get rid of the evil entities. We also historically read about curanderos from Mexico and native border towns. Those are known in English as medicine women. And they would use herbs and psychoactive plants, which we now know of as hallucinogenic plants, to treat people. They would also use different plants, magic, different traditions of spiritualism to induce visions, to help again to heal. This was also a way that the curanderos imparted traditional wisdom. Some of these medicine women also anointed with oil, basically rubbed oil into the skin. But these spiritual and medical traditions were passed on from generation to generation, and this is what we see in ancient civilizations as the historical roots of massage. Just like we're realizing that religion and medicine were intertwined in ancient civilizations, also essential to those civilizations was water. And large rivers are where large populations were able to be sustained. In ancient times, water therapy was used to not only cleanse, but also purify the body of disease, and disease, quote-unquote, calling spirits, but bathing, steam rooms, sweat lodges, hot springs, massaging with essential oils. These are all tracked back to these ancient civilizations around large rivers. Now, these are rituals that still exist today. You can still go and do a sweat lodge today. But there are 4 areas that I'd like to highlight for you. 4 areas have historical interest and records suggesting the use of massage in their developing civilizations. The first area where we will walk in the shoes of those who came before us is in China, in the area around the Yellow River. That has widespread and extensive massage information found in all sorts of ancient Chinese records dating as far back as 2600 BC. One significant ancient Chinese document is the Kung Fu, which includes information on the use of medical plants, controlled breathing, massage, as well as a system of exercises in healthy positions. Does that sound familiar? The Kung Fu? China also boasts the Yellow Emperor's classic of internal medicine called the I Ching, which is one of the oldest medical references that still exists today. Chinese massage techniques were used to treat paralysis, reduce circulation. Common to China were techniques called Anma and Tui Na. Before we move into the next ancient river valley, we're going to visit Japan. From China, bodywork made its way into Japan, and many forms of massage developed. However, shiatsu is the most commonly recognized. Ama, a Japanese word for massage, is a push-pull variety of massage, and it was a derivative of the word anma, which is the Chinese word for massage. But ama combines deep tissue pressure, friction, and touch, and it especially is good for scleroderma. Scleroderma is a hardening or a thickening of the connective tissue, and ama works very well with this condition. The next ancient river valley that we are going to explore is the Indus River, and it is the site of the largest ancient river valley civilization discovered in the 20th century. It is now the area known as Pakistan and northwest India. Now, there's not a lot that we know about the Indus River area. In fact, it's being studied quite a bit today because there weren't a lot of written records that gave us any clues about their culture. One thing we do know is that the teachings of an ancient text, the Ayurveda, provided the basis for Ayurvedic healthcare. Ayurvedic medicine is a holistic approach to medicine that attempts to balance the body, mind, spirit to maintain health and prevent illness. Now, more will be discussed about Ayurvedic medicine and complementary modalities. And true Ayurvedic practitioners undergo years of training similar to medical school. Ayurvedic healthcare focuses on 3 energetic forces, and those are doshas called Vata, Pitta, and Kapha. We now move into Mesopotamia, and Mesopotamia was supported by the Tigris and Euphrates River. To frame it in, Mesopotamia is now the Middle East near Iraq. It's that area called the Middle East. Clay tablets and primitive paintings dating back as far as 300 BC have shown evidence of massage being used for healthcare. You see, both physicians and priests practiced medicine in Mesopotamia, which furthered the evidence of a relationship between illness and evil spirits. Early Mesopotamians also showed a keen understanding of anatomy. In fact, they were able to prescribe for certain medical conditions, certain herbs, but also evidence shows they were performing surgeries. I don't know, in 300 BC, I'm not sure I would have wanted surgery. The fourth of the ancient river valley countries that we'll visit is Egypt. And Egypt is supported by the Nile River. The history of Egypt follows a timeline similar to that of China and Mesopotamia, but ancient Egyptians developed a much more complex writing system of hieroglyphics and invented papyrus paper. In fact, on that paper, there are details about prayers and spells and amulets and herbal salves that were used in an effort to cure. In fact, their records were so well kept that they detailed intricate surgeries and advanced medical knowledge. There's also evidence documented by hieroglyphics of massage being used as a treatment by the mortal goddess Queen Isis. Queen Isis trained her priestess in the ways of a physician and how to use massage. In fact, ancient Egyptians had a much more detailed understanding of anatomy because of the mummification process. One final note about Egypt is the tomb of Ankh-Mahar. This is called the tomb of the physician. Now, it's debated whether or not Ankh-Mahar was actually a physician. However, the hieroglyphics indicate that the patient basically said, "Please don't hurt me." And Ankh-Mahar said, "I will make you so happy that you'll praise me." Now, that's paraphrased. You'll read the rest in your book. However, there are foot surgeries or reflexology being done, and so massage and medicine was prevalent in this ancient civilization in Egypt. We move from Egypt into Greece. And in Greece, the health regimen included exercise, massage, fresh air, getting rest, and being clean. The baths of Greece are very well known. Exercise and competitive athletics were so much a part of the culture that the Olympic Games were held every 4 years as a part of a religious festival. In fact, they would even stop wars to have the Olympic Games. Massage was a primary treatment during those Olympic Games, provided to minimize muscle exhaustion and also help tone the muscles. In fact, Asclepiades, a Greek physician living in Rome, proposed the theory that massage helps prepare muscles before a sports activity and removes extra fluid and metabolites after sports activities. Sounds like an early sports massage therapist to me. And the most famous of Greek physicians, Hippocrates. Hippocrates was born in 460 BC and died in 377 BC, and is considered the father of medicine. The Hippocratic Oath, do no harm, continues to be the foundation for many healthcare professions, including massage. That Hippocratic Oath also includes direction on treating patients with the best of intentions, and also swearing to give treatments that are only beneficial. And also, even as early as the times of Hippocrates, we were asked to vow for patient confidentiality. A follower of Hippocrates, Galen of Rome, wrote 16 books on massage and remedial exercises that not only described massage and gymnastics, but described the pressure, the direction, the frequency of the treatments that were recommended. Another follower of Hippocrates, Celsus, wrote 8 manuscripts, 8 texts called De Medicina. And in your book, you'll read a lot more about people of Greek and Rome who wrote about massage and medicine. Now, the culture of the Greeks continued to influence Rome until about 150 CE, when the fall of Rome began. And at that point, they lost control of culture, of religion, and really the power and the glory of the Roman Empire finally faded out around 500 CE. After the fall of the Roman Empire came the Middle Ages and the Renaissance. There are beautiful images in your book that were drawn by Leonardo da Vinci and René Descartes, and all sorts of interesting insights into the Middle Ages in Europe and in the Arab world. We're not going to dig down into that during this webinar. However, I do encourage you to read through that thoroughly in your text. We're going to move along to the 18th, 19th, and even the 20th century. Medical history made great strides in the 18th century. Noteworthy is the discovery of vaccination and inoculation. The world was becoming logistically bigger. In fact, in 1776, the Declaration of Independence was signed, and more knowledge was being shared across the globe. This is demonstrated in the translation of the ancient Chinese manuscript, the Kung Fu, into French by a man named Thibaut in 1779. A name you'll get to know and love, Per Heinrich Ling. Per Heinrich Ling is known as the father of Swedish massage. He founded the Royal Institute of Gymnastics in Stockholm, Sweden. Ling founded the institute in 1813 after developing the Ling treatment, also called the Swedish treatment cure, most likely where Swedish massage, the name, came from. You see, Ling was working his way across Europe. He was a Renaissance man. He was translating and writing poetry. He was translating and writing plays. But along the way, he learned to fence. And the repetitive stress on the one side of his body gave him elbow pain. Well, consequently, he incorporated gymnastics into his health regimen and relieved completely his elbow pain. Now later, as the popularity of Ling's techniques spread across Europe and Russia, they were called the Swedish movements or the Swedish movement cure. Eventually, the Swedish movement cure became Swedish gymnastics. And Swedish gymnastics, that's a movement system that has 4 categories of movement, invented by Per Heinrich Ling. The aesthetic category, aesthetic movement, gives expression to feelings, emotions, and thoughts through movement. Educational movement develops the innate potential of the body through good posture and control, re-education of the body. Medical movements correct bodily defects, and that's with active, passive, and duplicated movements. And there's military movements, military gymnastics, military exercises that strengthen and toughen the body. This was the philosophy of the Swedish gymnastics movement system, invented by Per Heinrich Ling. You see, Per Heinrich Ling included classifications of active, passive, or duplicated movements as a part of the regimen of his gymnastics system. We actually still use some of those same definitions today. Swedish gymnastics warns us of contraindications to exercise, which are also contraindications for massage listed here. Torn ligaments, torn tendons or muscles, unhealed fractures, immediately following surgery, uncontrolled high blood pressure. These are all considered contraindications for massage and for exercise. A high fever, we could go on and on. However, it's good to know that Per Heinrich Ling is given credit for inventing Swedish massage. The contribution of Ling's work is certainly better known than that of other historical figures in massage, but there are some people who are equally important in massage history, one of those people being Dr. Johan Mesger. Dr. Mesger of Holland coined some of the terms for massage techniques still used today, such as effleurage, petrissage, tapotement. It also seems funny that somebody from Holland who speaks Dutch would choose French words for terminology, but the French word massage, masseuse, and masseur were already getting popular. He was the first to identify classic massage strokes and differentiate them from Swedish movements and the Swedish gymnastics. Mostly Swedish gymnastics were exercises that sometimes included massage, but Dr. Mesger really pulled them out. Dr. Mesger's work was instrumental to reviving interest in massage in medical settings as a doctor. Doctors who had an important effect in the United States as far as the promotion of massage therapy are Dr. Charles F. Taylor and his brother Dr. George H. Taylor. You see, healthcare was making a transition in America during the 19th century. That's in the 1800s. And healthcare was going from kind of folklore, folk medicine, odd treatments, uncertainty, to professional medical care. Massage first got noticed in the United States through Dr. George H. Taylor's medical practice. He and his brother Charles were really the first integrated medical doctors. George eventually became the founder of an institute called the Remedial Hygienic Institute in New York, but he taught his patients about the benefits of wellness and understanding their illness. So he would explain things like the importance of good nutrition and why it's important to drink a lot of water, and incorporated massage therapy. In fact, this is the first time that we see a patient lying on a table for the entire session. In Dr. Taylor, something called his movement cure, which is a variation on Ling's Swedish movement gymnastics. But George brought Swedish movements to America and incorporated them into his practice. And this is, again, the first time we see a client laying on the table for the entire session, very much like we do massage today. So as good things are happening in the United States, interesting things are happening across Europe and in England. In fact, 8 women founded the Society of Trained Masseuses in Britain in 1894 as an attempt to set a quality control, a high standard for massage therapists. They modeled their organization after the medical profession, so massage therapists had to meet specific academic requirements. They had to pass a board examination and receive their training from a recognized school that hired accredited teachers, qualified teachers. In fact, when it expanded its membership to 12,000 members, The Society of Trained Masseuses became the Chartered Society of Massage and Remedial Gymnastics. They were really making progress. In fact, there's a lot of things that were happening at this time and were about to happen in the early 1900s that put massage back on the map. Massage in Europe and Britain continued to establish a strong foundation of growth. In fact, the medical community respected the practice of massage enough to encourage nurses in British hospitals to become certified as massage therapists. Specifically, the doctors were finding it beneficial to rehabilitate soldiers from World War I and II. Now, in particular, private patients were interested in getting massage on a regular basis, so there was a great increase in the number of nurses who took massage courses, and you can see some of them pictured here. Jumping back into America, Dr. John Harvey Kellogg was a physician who pioneered the health food movement. Yes, he encouraged people to eat dry cereal for breakfast as a part of a vegetarian diet. And yes, you may have guessed it, Kellogg's Corn Flakes, the cereal giant, was founded by Dr. John Harvey Kellogg. Soon thereafter, Dr. Kellogg became superintendent at the Battle Creek Sanitarium. Now, this sanitarium was not like we know it today, where people go with mental health issues. In Dr. Kellogg's day, the sanitarium was the place where people went to learn to stay well, to be well. In fact, this Battle Creek was a medical and surgical center where people were taught the principles of good health, such as proper diet, exercise, massage, the importance of fresh air, good posture, the importance of good rest. The guy with the big mustache here is a younger version of Dr. Kellogg, and he made some very important contributions to the history of massage. He conducted extensive research on massage, examining, defining the mechanical, reflex, and metabolic effects of massage on the different systems of the body. And you'll read more about this in your text, but understand there are mechanical benefits of massage, there are reflexive benefits of massage, and also metabolic benefits of massage. In fact, Dr. Kellogg published a very popular book called The Art of Massage, which was a manuscript that those people who were interested in learning how to do massage used as one of their early textbooks. We move now from the 1950s to the 1960s. And for as much as bodywork has evolved over the previous thousands of years, massage has grown exponentially in the last 50 years. In the mid-1960s, a never-before-seen counterculture blossomed throughout the United States, inciting both the flower power movement as well as a general rejection of the straight-laced Ward Cleaver-esque American, no longer wanting to keep up with the Joneses or confine themselves to a white picket fence. These young, idealistic masses would soon be known as the hippie generation. But the hippie movement wasn't just about experimentation and trouser flares. As mentioned previously, the concept of flower power also emerged as a passive resistance to war. In fact, a beat poet in the 1960s, Allen Ginsberg, coined the expression as a way for people to turn war into peace. And actually, they started exploring massage as one of those pathways to peace and self-exploration. And self-exploration could be one of the themes of the Esalen Institute. Esalen is one of the first modern places where massage was being taught and considered bodywork as a pathway to well-being and personal growth. Esalen is located in Big Sur, California, on over 100 acres of mountains, with 27 of those acres being Big Sur coastline. In fact, became famous for its beautiful landscapes. It also became famous because it is the birthplace of the human potential movement. Additionally, Esalen has been known for its blend of Eastern and Western philosophies, its experiential workshops, the steady influx of philosophers, psychologists, artists, religious thinkers, and also because it was that time of that hippie generation, there was also a lack of clothing and a lack of draping. Now, we're not going to be learning that kind of massage. The Esalen massage is a fluid and flowing combination of the structured, sweet